Record. So, welcome everyone. So, communication, one of the most important scenarios in the exam. Why do you think communication? Okay, now you need to use your fingers. Okay, typing. Why is communication? I would say one of the most important stations in the exam for MRCPCH. Just type anyone. Just type. Why do you think rather than it is one? You can say it is one of the fundamentals of passing the clinical. If you got this right, you can get over a lot of things. And that's why we're going to spend a lot of time on this one. So it is interpersonal relationship. Very good, Aniruddha. Absolutely. Because it will impact all the stations. Very, same simple as that. This one thing will, in the exam, your examiner is at the end of the day, they have seen that you know your theoretical stuff. Part and part two, they know that, yeah, you know theory. But now they are actually going to see you. And basic is, are you presentable? Are you talking like a good doctor? Are you talking like a safe doctor? Are you overconfident? Are you brash? Are you someone, the type of person who will you piss the patient off? You know, the patient will become pissed off. Has everyone come across doctors who are very good academically, very good. But somehow when they come in front of the patient, no patient likes them. Have you all come across those doctors? Yeah? Put your hands up, fingers up. You know, have you come across those sort of doctors? Yeah? Very good. Theoretically, absolutely top on. But when you see the patients will just want to be away from them. They are the people who get maximum number of complaints. No one likes them. So it is the most important skill as a doctor. And it's for this part of the exam, the clinical. Yeah, knowing the patients more. For the clinical part, this is the foundation. It will affect your history taking. It will affect clinical also to some extent. Clinical is more of your the company what do you call the short clinical and all. These are though they are more based on a technical skill because you have to see how you're examining the patient. But if your body language, your tone, your language, and your basics communications skills are not right, in fact, the initial part of even the even the short clinical is based on communication. And if you don't get that right, you already lost marks there also. All right. So with that, I'll start. But as I said, please, I'm not seeing everyone's photo on the thing, but please feel free to use the chat box. That is the lifeline between you and me. Okay, that will keep us going. So if you're all ready, just say ready to go. Because now we'll start off straight away. And you have to keep your energy focused. I'm telling you, what I'm going to say every word is important. So ready, everyone? So we are going to launch off. Okay, rocket is going to launch off now. All right, absolutely. So ready, put ready. Okay, so now we come to it, which is the thing. So no frills. When I was in UK, there was a supermarket. Yeah, because initially I didn't have much money. You know, I had loaned money. I was trying to pass the exam in UK, not like you guys sitting in Calcutta and giving the exams and you're having a good food from home and luxury. When I went, we borrowed money. My father, the company where my father used to work that had closed for 3 4 years, no money really. I somehow still took some money, went to the UK, and still there was difficult to pass the exams. And I think so. We stayed in a rented place with not much of money there. And there are, I don't know if you know about the UK, there are different types of supermarkets. Okay. So there are some very top-notch supermarkets, very costly, where the rich people will go, something like Sainsbury's. These are the top-notch, where everything is a bit costlier. And there are the common middle of the thing like Tesco, Asda. These are middle of the grade. Okay. If you ever go to UK, you know that. And if anyone hears of no frills, do you know what no frills means? With nothing extra. It is for the poorest of the poor people. Okay. But it has got only the essential. So we used to buy from there. So I bought Coca-Cola from there, their version of Coca-Cola. And I'll tell you, I will never have tasted anything like that. Or even if you had what do you call popcorn. Yeah, not popcorn, what do you call cereals. So we had cereals from there. It was as a box. They wouldn't spend money also in the coloring because it was so cheap. So white box and black, everything written in black. That's it. But the cheapest you can get. Like office don't complain. So no frills, what we are trying to say is nothing extra. What we are giving is the minimum, bare minimum. So what I'm trying to put in the communication is I'm going to put the bare minimum, more than that, because it is for you to pass the exam. Communication is thing, there are loads of courses, there are 3 year courses, there are, lots of books, there's no end to it. And it by itself is one of the most important skills you can have in life. And if you follow what we are going to talk here over the next about 1 hour, I think. I can tell you, if you get the fundamentals right, not only will you be a great doctor, okay, your patients will love you, and you will see why with the same knowledge, some doctors are much more popular than other doctors. You'll get the secrets will come out. And at the same time, for your life also, for your, the communication applies also to your friends, your family, and in general. There is no part of life your communication does not matter. So we're going to talk about the basics of communication. Then it's up to you how you take it from there. Okay, so with that, we'll move on. So no filament, very important. What I'm going to see, each one is important. There's nothing unnecessary I'm going to talk about. So now domain marking. Now you've seen this chart, and I'll tell you this is your holy Bible, holy Gita, or whatever you call it. Okay, because this is the chart you have to know, because this is exactly what they're saying. What is needed for each table, and I would say get it on your mobile app. Take a shot of it on your mobile or make a printout and go through it every day, because this will make you understand what the examiner is looking for. So domain marking. We are talking about clinical examination. Okay, so if you talk about communications here, since you've got two, I've got two tables, mind you, two tables with communication and how they're marking you. So one is accuracy of information. So you cannot get away with saying, all vague things you don't know, and you're saying, unwanted things. You're saying wrong things. You will be marked out. So they are marking you 4 marks just for accuracy information. Okay. Then it is about rapport and communication style, 10 marks. Now understand this. Try to get to understand. It is only about how you're talking, not what you're talking. And communication style, that is 10 marks, maximum marks. Can you understand? So rapport means how well you're getting on with the family, or how well you're engaging with the parents. Are you making them comfortable or not? Are you listening to them properly? Are you being overconfident? Or you don't seem to have any confidence at all? You seem very nervous. So, and communication style, is it a pleasant style? Are you doing it in a structured way, the information you're giving them? Or are you doing random? Okay, a lot of what I'm going to say over the next few slides will repeat itself, but on purpose, I'm repeating a lot of things I'm going to repeat again and again and again till you get it hammered inside your head. Okay, verbal and listening skills. So, verbal skill, see, obviously, see, these are two tables. There's 6, after 10 is 6. So, that means you are how you're speaking, do you know, and listening skills, believe me. So, you are being given marks for keeping quiet. Understand this. If you keep your big mouth shut at times, you will be paid. You will be given paid with good marks. Now, this is very difficult for most of us to understand. We think that, okay, that time is there. There's so much of information I have to give, and no, you lost it. You lost marks. You have to listen as well. When you're talking something, it's a two-way conversation. Are you listening to the parent? Are you listening to their concerns? When the parent is trying to do something, are you interrupting them? If you're interrupting, means you're losing marks. You are losing marks if you don't allow them to say. You might think that, oh, I've got so many things to say about Down syndrome. I have to break the bad news. Or I've got so many things to say about the bad progress or good progress of leukemia. And the parent is asking me questions, oh, why is she interrupting me? You are being marked not on how much information you're being. It's not quantity, it's quality. Are you respond, because leukemia, there's so much of information. You are being marked for, are you meeting the demands of the role player in front of you? The role player might be interested only in few things. Are you able to respond to that? Is he in pain? Will treatment be painful? How long will it be painful? Rather than you are considering too much about prognosis, or some other parts of the thing, how costly or whatever. They are more interested in certain other things maybe. Will he feel comfortable? Things like that. So that is management concerns and agreeing steps. Next steps 4. So this is why you have to you have to start. It's like any movie. Movie has a beginning, an introduction scene. Then you set the tone, you set a structure to the movie, and the movie then gradually, or any good story as well. Then there is the ending, beautiful ending, isn't it? How the things resolve. So here as well, managing concerns. So at the end of the by the end of the thing, when your time is coming to the end, you should have been able to at least manage their concerns, even if it's a difficult case. So it's a breaking bad news, or suppose there's a conflict resolution. So these are very difficult ones, but at least you have come to an arrangement. Okay, that if it's a bad, suppose they wanted it's a something that, there's a scenario where someone has done a dose error and you're supposed to talk with the parents. Obviously, it's not going to end in a very positive note, but at least you have managed the concerns. The parent is saying that I don't want this to happen again and I want to complain. So at least you will say, yes, we are taking steps so that I'm sorry this has happened, but so this never happens again. And to ensure, and I understand you're very angry about this. So we have got a complaint system procedure for complaints. My nurse will come, or I will come in soon later on, and the head sister will come and she will give you the complaint form. And she will give you all the details of how to fill in the complaint procedure form or how to meet the complaints team. So you're agreeing the next steps. Or if it's a child abuse situation, and the mother is saying, "Oh, I want to go home, and I think my child is fine," then you have to agree, sorry, we are concerned about this child. I know you think the child is okay, but the law, our system is such, we have to follow some protocol. And there are some scar marks on your child or some bruises on your child, and we are worried about your child's safety. All right, no one is blaming you because oh, are you blaming me? I've done this. No, but it is our duty to make sure that till we are sure about what the reason is for this child, for these bruises, we have to keep the child in the hospital. And in the meantime, I know you're concerned. So we will get my consultant will be coming in a few minutes. You can talk to him as well. He will give you further information. So these are the next steps. Have I made myself clear? Is that okay? So you're checking that you've made yourself very clear what is the next plan of action. So that is what it is. Managing concerns, agreeing next steps. So you can see what it is. Okay, we'll move on to the next one. Now again, what does it mean by saying that meet standard, borderline, and below standard? So understand each one of them. You know, information sharing. So accuracy of information is the first one, broad headings. Second one is rapport and communication skills. We saw 10 marks. Verbal and listening communication skills and managing concerns. So what we're going to talk briefly what it means. So information sharing means you say accurate information and you say it in a structured way and then you summarize it. That's what is a standard. What is a below standard? Inaccurate, irrelevant information not related to it, and you say all in a very unstructured way, and you're not checking whether they are understanding what you're saying. You are going very fast and you're not, and the mother is keeping blank, she's not having any response, so you're not even sure whether she's able to follow you. Borderline, obviously there is some inaccuracy, there is some lacking of some structure and some limited verification of understanding. You're not checking it properly. Now, what is communication skills, rapport, and communication style? So this is the one where you had around, I think this was the one where you had 10 marks, which is the very important one. 10 marks, okay? So you got to get this right. So what is happening here? So confident, so appropriate level of confidence. But that means also not overconfident and also not underconfident. Greeting and introduction. So you greet the parent. So hi, Mrs. Sen. I'm Dr. Chakravarty. Uh, uh, how would you like to be addressed? So you start with that. Is it okay? Do you have a few minutes to speak to me? She says yes. And then you start with saying, how would you like me to address you? Because that has to be very clear in that country. That is the standard thing. Would you like me to address you as Mrs. Sen or Miss Sen, or someone would say, no, I'd like you to call me Anita. So then you have to check it. That is the standard in the UK culture. Appropriate body language. So obviously, appropriate body language means always sit at the same level as you cannot have the parent sitting and you are standing. Doesn't happen. Always same level. So you would sit down at the person's level. Okay. And the voice cannot be too arrogant or too soft. Okay. So it has to be gentle and sort of practice it getting at the right level. And response to verbal and non-verbal cues. So suppose you have started saying, now I understand that your child, we'd always start with, okay, doctor, so I just wanted to check, have you been given any information about, are you up to date with what's happening with your child right now? So suppose it's a child, who had a gentamicin overdosage, and, first, before you start anything, you want to understand how much the parent knows. Because the parent might not know anything, or the parent already might have some information. So always check what is the level of information they know. So check that. What is verbal and non-verbal cue? So she's saying, no, suppose she's saying, I'm so upset. Why did this happen? and she's quiet. And she's using, this is the thing, okay? This is what you call verbal, non-verbal cues. So the cues means body language. I'm not sure why this happened. Why it happened to my child? So this is your, that's why it's actor ticket for a role, okay? So this is body language. So in that case, you would listen to the person, you would keep quiet. That means you're giving respect to the patient's, what the patient is trying to express, not verbally, non-verbally also. Then you would ask again, Anita or Miss Anita, uh, is there any way I can help you? Do you like a glass of water? Do you want the nurse to come in here, be with you? It seems that you're very upset. You give some time. It shows, it doesn't, what you will not do is just non-stop talk or keep talking about what has happened and the gentamicin levels and it can cause hearing damage and all that. No, 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 no. You first respond as a human being. That is what it is for. All right. So introduction develops appropriate rapport with the role player. Yes. So you keep talking at the right level, puts the patient at ease. Are you comfortable? Am I making myself clear? Clarifies role and shared agenda, appropriate tone and pace. To clarifies role means first you make clear what is it. So I'm Dr. Chakravarty, I'm the registrar here. I've come today to talk about your child, your baby who's in the neonatal unit. I've got something to say about what has happened. And they'll say, I don't know if you've heard, but I'm sorry to say that today while giving the medication, one of the antibiotics was given, several times the normal dose. It was given 5 times the normal dose by mistake. I'm sorry to say that. So then the mother would get very angry. No, then you say, I'm here to tell you the details of what steps we are taking to make sure that child is safe. What is the plan of action and what steps we are taking so that this does not happen again. And also, I know in this situation you might be wanting to make an official complaint. So I'll go through our details about how we can do that. So you're very clear what is your purpose for the meeting. It's very, very clear right in the beginning and very quickly. But if we practice it, we'll know. So what is the purpose here? That introduction, how much you know already the parent, and what is the purpose? Now, obviously, if you're not having body language, you're talking too rudely or too loud or very, hardly your voice can be understood, then it is, that then you will lose marks. So again, poor body language, unprofessional manner. So you're interrupting the parent, insensitive or overconfident. You're talking very overconfidently. Poor rapport. And when the mother is silent for 10 seconds, 15, 20, 30 seconds, you are carrying on talking one-way dialogue. No clarification of role. Or you're talking in a very rude way. E2 is verbal and listening communication skills. Active listening and displays interest with role player. Allows the other opposite to speak. Appropriate language used in challenging circumstances with any jargon explained. What does that mean? So listen. How does active listening mean? Active listening means you keep quiet, but you lean forward with the parent, and you sometimes like what we do, we nod your head to show that you're listening. Okay. All right. So the mother is saying about, okay, I heard this happen, or I'm too so worried about this still, or my other child was also had a difficult labor. So listen, oh, I'm sorry to hear that. Okay. All right, all right. Okay. So so you're nodding your head, you're having eye-to-eye contact. Oh, I'm so sorry to hear that. All right. Is there anything else you want me to say? Or, oh, that must have been very difficult for you. But it should appear as normal. Don't make it forced. Okay. So those are the things. And without any medical jargon. Now, what is the problem here? No active listening, and you're missing the cues. Mother is becomes absolutely quiet, means she's in a shock, and you carry on. You don't do that. You keep quiet. Are you okay, mother? Do you want me to explain something again? So that's so interrupts occasionally, you wouldn't interrupt that. And you would say the language of a 10-year-old. I said again and again, the UK exam is designed in such a way, whatever you're saying, a 10-year-old child should be able to understand. Okay? 10-year-old should be able to understand. That is the standard of the UK exam when you're talking to parents or family members. So obviously you're below standard if you're interrupting. Language is over too many technical terms. You're not interested. So the parent is saying something, and that time you're looking at your watch, you're looking somewhere else. So that shows that you're not interested or not looking at the eyes. Obstructive. You're again and again obstructive. Or the mother is crying and you're just carrying on. The mother is upset and you're behaving just like a robot. You're keeping on talking. Okay, so that is when you're sure fail. Managing concerns and agreeing next steps. Seeks, identifies, acknowledges, and attempts to address concerns appropriately. So the mother may have two, three separate concerns. Identify those concerns. Encourage her to ask to express her concerns because she might be very nervous. Okay, can you just put your, say on mute, Aniruddha and others, just put yourself on mute. Yeah. So address yourself and concerns so that you can carry on. Okay. So that you make sure that when you're saying something, suppose you're saying something about a condition. Suppose you're talking to a parent that the child has got or something like thalassemia. You're talking about thalassemia trait or something. Or maybe you're talking about a child has got Down syndrome. So you'd have to make sure that you're understanding what you're saying. What is Down syndrome? What are the problems that happens? Okay, what is about lifespan? What are the tests you want to do? So you have to see now. You might have your own list of things to say, but parents' concerns you have to ask. That is the number one job you have got. Answer the parents' cause. What is their concern? Is will he live a normal life? Or their concern will he survive? So then you have to answer that properly. Okay. So displays natural empathy with the role play, and this will come through practice. I see most of you are, I think all of you are good doctors. You are empathetic. I'm sure you behave very naturally with your patients. So be your normal self. But when it's exam, it has to be identifiable. In the actual the exam, the examiner will be seeing that yes, you are empathetic and natural empathy, and checks that understanding, and you check with the understanding, and you go for the next step. So if you're obviously not doing very well, no attempt to check or address concerns, you do not empathize, and directed delivery, no attempt to check the knowledge. So you're never checking that in between. Every few minutes you have to check, uh, am I clear so far? Or is there anything is there anything more you want to ask? So that's all. Or in the end, you say that, okay, I would like to summarize what we have talked so far, and so and so and so and so. Is there anything else you'd like to ask? So you have to keep telling that. No false reassurances or promises. So this is very common. Sometimes we have got a child with a bad prognosis, maybe someone who's got, suppose, a head injury and is going to a tertiary level unit. And the parents they're trained, like in real life, the examiner, the role player will say, so doctor, is my child going to be alive? Please tell me that he's going to get okay. What will you say? Will you say, yeah, your child is going to be okay? Just type on the thing. What is your answer to that? Teenager child has a bike accident, very threatening, life threatening. He's on ventilator. He's going to, and you have transferred him to another tertiary level unit. The parent is asking you, please use your fingers. Parent is asking you, doctor, will my child survive? Yes. Thank you. Carry on. Will my child survive? Please tell me that he's going to make it. Is he going to die? Yeah. Is he going to die? Will he live a normal life? Will his brain work okay? So the last thing, yeah, you can say we are doing everything possible, but it's too early to say. Absolutely, that's the right thing to say. And get used to this language. Get these sentences, get into your head. These are the right sentences. We are trying our best. Yeah, yeah. Don't say please try to relax because that sounds very tired, very typical. See, I know it's stressful for you, but we are trying our best, and we are trying our best. I can promise you that our doctors are doing the best. Yes, he's being transferred to a hospital where it's a tertiary level unit. We have got highly trained doctors there, and we will keep keeping you informed, as things move on. But obviously, I say that way. That is the best way. Don't say that, no, I can't guarantee that. Don't say that sort of thing. Oh, no one can tell whether they'll live or not. That is not the way to say. Because you're saying the truth, you're not saying anything false, but in a very roundabout way. Yeah, we are trying our best. Everyone is giving their best. That's the way to say. You can never say that, oh, don't worry. Yes, he will live. Oh, yes, his brain will become hope. Fine. Oh, yes, he's going to make it. Don't try. Even if you want it, you cannot say that. Because tomorrow when the child dies, then you will be facing a court case. That you said the doctor, you said the child is going to live, and now that he's now brain dead. Don't say that. Okay, is this clear? Are you okay now with this? Then we'll move on to the next slide because this slide is I'm spending so much time. Okay, so under this put a thing. I hope you've got an understanding of the Main domains, yeah. So just use the chat thing and just say yes. So I know that you're not dozing off. Yeah. What about others? Yes, yes, yes. Yeah. So that's good. How many of you are there? Five, six of you. That's fine. So let's move on to the next one. Okay. Let's move on to the next one. So again, I've just highlighted this one, which is we've already done this. Okay. We've already done this slide. So I just move this one. One second. So this one just I just highlighted what is the actual thing you need to do. This is what we've already done. Okay. So we'll move on. And obviously, what are the timing? I think you know that. I think you know the timing anyway. Just one second, 9:40. Okay, sorry, 9:40. So 4 minutes. So wait outside. It's a 9 minute station, and then so time will just fly, and then you will have 6 minutes inside. So time is very short, in fact. And in that 6 minutes, where you will have 3 minutes when you have got about 3 minutes left, someone will knock you. That 3 minutes left. So that is the time when you're supposed to summarize. Okay, that is the time when you have to summarize. So what are the mistakes people do when they're outside? So, when you're outside, what is it that you've got to do? So, it's just again how the time goes. So, okay, before that, so what are the mistakes people do? So, when you're outside, what you should do is take the pen and pencil. You'll get a pencil and paper, and you will get the scenario. Please write down the name of the mother or the parent. Write down the name and age of the or the sex of the child. Okay, mark everything. What I'm trying to say. You have to get these three pieces of information: name of the parent, name of the child and sex. Number three, what is your task? Okay, what is your task? Please write that down when you enter the room. All right. Otherwise, people, it's amazing how many people enter the room and they, oh, I forgot your name. What was your name? And then you start looking at the paper. You have already lost 4 months there. Or you're saying the child, forgot the name of the child. Or you forgot what was your task. You forgot what was the task. Okay. So I hope you got that clear. The 3 points, okay? 3 points. Now, communication skills and overview, all right? So I hope you got that because that has to be a very clear understanding of the 3 points, all right? Overview. So basically, very quickly, now why we struggle, now especially we are overseas candidates, English is not our first language, as you know, okay? Let me just see. Yeah, eye contact is not encouraged and we are not part of a training. So as I said, eyes always you look in the face. We talked about that, eyes to eyes. And we are unfamiliar. The social practices in the UK are a bit different from ours. And we have different doctor-patient relationship. Here in India, it is more, in general, in government hospitals, it's more of a doctor is on a pedestal higher up, and the patients, because of the lower socioeconomic status, they are lower down. And in general, we talk down on the patient. We tell them, this is what you do and they cannot ask you too many questions. This is what you do. Why? Because I told you so. That's it. No one can ask you why. It's just the way it is. So for here, they will, in the UK system, the parents have a right to ask you questions. And we will have to answer it in a very humble way, in a very, very reasonable way. You should not be offended if they're asking you questions. It is a duty to answer there. But these can be learned because these are different scenarios, but you can learn it. That's a good thing. So types of communication. Now, this is very important. We need to have a very good idea. What is the different types? So one is the information type, and you have to know about different types. How to, how to approach everyone differently. So please tell the teenager about a diagnosis. Suppose a teenager means a teenager comes who has been, I don't know, who, who's been diagnosed with anorexia nervosa, or suppose who's having some problems with his, his diabetes is worsening, or his asthma is worsening. So then you have to talk to the teenager. Teenager can be very challenging. It's your duty to tell them. The teenager, way you talk to a teenager is very different to that we talk of parents. Breaking bad news. So how will you tell the results of the ultrasound and the bad news? Consent. Why you need to do a lumbar puncture? Why it is important to do it? Critical incident. Please talk to the parent of the child. We talked about the gentamicin problem, wrong drug, or it has been given several times the same dose. And you have to talk it approach in a different way. Ethics. Please discuss the problem Anna has because she has refused to take blood tests. So we know something called Jehovah's Witness, where they do not have blood transfusion. So then how do you talk to the parents in that case? And education. So please explain to the SHO that she can deal with the situation. So sometimes you have a junior SHO, you are a senior registrar, and you have a junior registrar, or you might have a intern, or you might have a junior nurse. She's newly joined, and suppose in the rounds you came across the patient, a child who had what do you call what Fallot syndrome, Fallot tetralogy. So then you are supposed to explain to the SHO. You might have to draw a diagram and explain what is Fallot tetralogy. So be prepared. Now always remember, you will always be given extra marks if you're using a sheet of paper and a pen for the exam. Obviously here online we will not be able to do that, but in general for the exam, so whether it is explaining what is thalassemia, or explaining what is phallocytology, you would expected that you would do with a pen and paper. You get some marks extra. Now what is the purpose of communication scenario? Right? Purpose of communication scenario. So obviously you have to talk to the parents and make them understand in a simple way. Yeah, simple way. Yeah, so some question, Rohit, we can write on the paper provided to explain. Yeah, you will get a sheet of paper. Don't worry about that. Okay, on the paper you have got a little big sheet. There are extra papers anyway. You can ask for it, and you can draw a diagram and you can explain to that. So okay, that is used to explain. That is one of the standard things you do. All right. So that is a very standard thing you do. And okay, so ability to connect with adolescents. So again, you have to be know what to do, how to talk with adolescents. Bad news, how to talk to about bad news, how to talk about that, and we'll practice that. Explore issues, problems not apparent or volunteered. There might be problems like issues about child abuse and things like that. So that has to be resolve conflict. So there might be conflict situations like you have a scenario where your registrar is not doing. You are a senior registrar. You've got a junior intern. The intern is not doing his work properly. Okay, he's coming late or he's not doing the notes properly. He's changing the notes afterward. There is a scenario like this. And your consultant has told you, right? Okay, now we have noticed that the junior registrar is doing these mistakes. He's just newly joined. Can you please counsel him? So that is a totally different counseling. You can't just say, like, it's not like in India where you can say, hey, come here. Do you know what you have done? You have made all these mistakes, one, two, three, four, five, six. Get it right, otherwise I'll complain to the teacher and you will be suspended. It doesn't work like that, okay? So it's a very different way how it is done. So obviously they are all, it is done in a different way. So how it is done, we'll be practicing those. So so convey all necessary information is structured and succinct in a format to colleagues so they understand. So these are the basic purposes. So non-verbal cues, we say if a parent is, doing like this, obviously she's upset, you know. So, or she's just staring at you in a very angry way. So that is also, bad. Is verbal, non-verbal cues. Flexibility, adaptability. So you have to be flexible to how the situation is and you adapt accordingly. And obviously, so the task, what is your task? What is the structure? And then you summarize in the end. Let's move on to the next one. So how do you move on? Structure. So always make notes if possible. As I said, use the paper and the pencil. They are given for a reason. Plan how we'll break the news if it's bad. So obviously, suppose it's the baby with Down syndrome. Okay. So how will you break the bad news? Okay. So how will you do that? Anyone wants to say how will you do? How will you start? How will you start? I'll ask Dr. Mohammed if you don't mind, because Dr. Mohammed has got his exams. Dr. Mohammed, how will you start if you got a diagnosis of Down syndrome and you got to explain to the parents? Are you there? Hello, Dr. Mohammed, are you there? I can't see anyone. Anyone else? Am I audible?
Yes, yes, you're audible.
Okay, but is everyone else sleeping apart from Aniruddha?
No,
Nobody.
no, we are.
No,
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 no, no.
Okay,
sir, we are
Everybody
here
is there.
only.
you are here.
No,
Okay, so then
sleep.
just tell me how would you? Aniruddha wants to say something, but I want to give someone else a chance first. So Mandira, tell me how a child with you just come out of the labor room and you look clinically, you are more or less 80% sure that this is a Down syndrome, or maybe yeah. And so now the parents are there. You got to speak to the parents. You got to break the news. So tell me very briefly, how will you do it?
Okay. Hmm.
Don't worry, this is
Sir,
a trial, not your exam. So
just now delivered. Like the baby is just now delivered.
okay. So I'm
No,
the
like I'm
parent.
asking, sir, just now delivered.
Yeah, you've just come out of the, I'm waiting outside. You just come out of the, you
Okay.
just delivered
So
the baby and you've come out to give the news to me.
okay, okay. So, sir, first I think I'll first congratulate them that
Yeah, so
your
tell me,
baby
I'm the
is
father.
born.
I'm the father. Tell me.
Okay. So Mr. Chakrabarty,
Yeah.
you I want to congratulate you first that your baby is born and she's doing fine. Like I'm assuming it to be her. She's
Yeah, yeah.
doing fine and she's feeding well and everything is fine. But I would like to just talk to you for I just want to share something with you. So regarding baby and so is this a good time to talk to you? So I'll first
Yeah,
see
yeah, doctor, what happened? What has happened? Why is something wrong?
yeah.
Is the child in
So
danger?
yeah. So the thing is that the baby
So
is
you're saying
born.
yes. I saw is the child in danger, and you said yes.
Oh, okay, okay. No, no, no. Sorry, sir.
So
I,
this
I
is the
didn't
cue.
I didn't
So
listen.
see, that's what I'm trying to
Yeah.
say. In the exam, very, very alert.
Okay.
See, I know you are
Uh-huh.
in your mind, you are very busy about what you have got to say, but you should be
Right.
more alert to what the other person is saying. That is being
Hmm,
alert
hmm,
to
hmm,
cues. Okay,
hmm,
say yeah.
hmm. Okay. So no, no, no. The baby is absolutely fine. But there are something that I want to talk to you
Okay.
regarding baby's condition. So we have checked baby thoroughly, and both like our team, the other members of our team, and what we can see that the baby looks like by the look, sir, we cannot say because it is not confirmed yet. So I just have
Yeah,
to
yeah. So yeah, you're right. So but you are
yeah.
suspecting,
So
so you
I
can
just
talk. What is it?
by look, yes. So there are some features which is very similar to a condition called Down syndrome. So, have you ever heard about do you have any, have you heard of it or do you have any idea regarding
Okay,
this?
that's fine. Okay, Mandira, very good. I'll stop you there. That's fine. So I think Andira, you did well. You did very well, I would say. Obviously, you have to practice a bit more to get the flow of it, but I think
Hmm, hmm,
under you got the general idea well. So first thing, obviously, when you got something like this, you first thing is you congratulate the parent, and why not? Because it's a healthy child at the end of the day.
Good
It's
baby.
a
Hmm,
healthy child. So you did the right thing. You will say, hi, Dr. Chakravarty, or hi, Dr. Mandira. Congratulations, you've got a baby girl. The baby's he's very active. He's breathing well. His color is nice and pink. And congratulations for that. Parents were very happy and all. Then you say very quietly, however, so you give a gap. Don't say immediately. You have to let the
hmm,
news sink in.
hmm,
Let the news
hmm,
sink in. Then few seconds. However, uh, just something we are a bit concerned about, which I'd like to share with you. So, doctor, what happened? Is something wrong? Is the child? No, the child is clinically well. Okay, there's no danger to his life as such, because that's what they are thinking. But when we had a look at the child's facial features, there are certain features where we are suspecting that the child might have a particular condition or a genetic condition, which is called as Down syndrome. Give a pause. Have you heard of Down syndrome, doc? Mr. Mrs. Mrs. Mandira, doc, Mandira, someone. No, maybe, no, I'm not that sure. Oh, I had something about it. Um, okay, so if you've got a few minutes, I'll explain to you. Even though now we are not confirmed because we are just clinically having a look, we will send some tests for it, and it's a condition. Then you say briefly, okay, so what happens in this condition, this and that, and then you say briefly that this is a child, who basically the muscle is a bit floppy, you know. We will do a few tests. There might be a heart condition sometime. We'll have to do a scan. There might be some conditions with the abdomen, with the internal organs. We'll just have a quick look or do a scan to do that. But will he live, doctor? Will he live? Yes, yes, he is comfortable. He will live. He's not immediate danger to his life. So that also concerns you will have to go along with the parents' concern. And then you decide about what is the plan of action. So for the moment, my consent will come later and speak to you. All right. The sister will also speak to you. we will get some investigations done, mainly some blood for genetic testing, and uh, and as I said to you, we will get an ultrasound done. We will get an echo done of the heart as well. Uh, uh, but I know this is maybe too much too much information for you right now. I will come back to you and speak to you in more detail. But at the moment, I can tell you that your baby is fine, is feeding well, is is settled well, and as I said, and a few after some time, my consultant will come and he will have a chat with you as well. All right. Is there anything in the meantime you'd like to ask? So that is the way. Okay, that is the way. All right. So anyway, introduce yourself and you check how they want to be addressed. Okay, that is obviously, in general. Eye contact, check prior knowledge. So obviously, you always have to check. We are talking about another other conditions. If something bad happens, or something your child is already admitted, and you want to know the child is already deteriorated. So you want to parents to check with the parents. Wait for so waiting is always few seconds wait. Go with the parents' pace. The pace at which you will go is at which the parents are going. So you cannot go faster than them. And always summarize and check understanding. Okay? I hope that is good. All right. Now, non-verbal communication, as you
Right,
know,
sir.
this is very important. And I think this is one of by now you should know that about 55% of communication is non-verbal, majority. The voice means voice tone and stuff. And the words are only 7%. So is it not funny? But the words, actual words, what you say, it only matters 7%. So any patient or any person, you think of it the first time you saw me or any other person. How do you judge the person? Or how do you judge me? You judge me by how I was walking, did I dress properly, did I look energetic, did I look intelligent? You make your judgments, isn't it? How is talk? So a lot of it is non-verbal. And then when I started talking, you confirm that. But and as you know, do you know how long it takes for people to make initial impressions when someone meets each other? Do you know? Anyone, when people meet each other, two strangers, how long it takes to make an initial impression?
First
Sir,
couple
eight
of minutes.
seconds. Eight
Yeah,
seconds.
absolutely. Something around 8 to 10 seconds. That's how fast you make a judgment. So 8 to 10 seconds, what will you see? You will obviously see how the person looks. If you're judging me, so you will see how I look, you know, how I dress, the energy levels, how a person is walking, how a person is moving. And then when I'm talking, so again, talking, you're not looking at my words. You're more what you see, you're looking at the tone of my voice. Is it very soft? Is it confident? Is it not confident? Okay. So these are what your words. So remember that when you're speaking. All right. Always remember that. Now, appearance, essentials of non-verbal appearance, facial expression. Make yourself, show your hands. You use your hands for expression, eye to eye, and appropriate expression, eye to contact, touch. So now touch you don't have to do here much, but sometimes in the actual scenario we used to touch the shoulder of the. If you're really worried, we touch the shoulder of the parents. But be a bit careful about that. But it will happen. Hand gestures. So you cross your hand, and if you sit like that, if you're and when you're speaking, it's supposed to be open hand with open gesture. But if you're closing like that and I'm sitting like that, means it's a closed gesture, means I'm not open with you. So these are basics of personal, what do you call, uh, body language. So if you're sitting like that with like this and you're talking to the patient, what does it mean? Anyone? What does it mean? Is it a good sign or bad? Tell me. I'm talking like that with the patient, sitting like that.
Bad sign. It's a bad sign.
Yeah, yeah. What does it
Closed,
mean?
closed gesture.
Yeah,
Like,
poor gesture.
not
The first,
interested, not interested.
it is a defensive. Yeah, it's a defensive. I'm closed. I'm all defensive when I'm closed. I won't open up to you. Whereas if I keep my hands open and I sit, I obviously can't see my whole body. Then if I have hands open, so that means that and your palms up, that means I'm open to you. I have nothing to hide. So that is how the body language is. Okay. So you come to know more about it by generally. Hand gestures, personal space. So obviously you can't you should not sit too close to someone, especially if it's a lady or someone. That is uncomfortable. But again, you have to not too far. So it has to be the right level. That you will come to know by practice. I think you know that anyway. I think if you've been in a social situation, you won't come too close. You won't go too far. It's just the right amount of distance. Paralinguistics, now that will, I think linguistics have to do with the language and tone. And body language, I think we've talked about that. Paralinguistics, I want you to look up That's your homework. What is paralinguistics? I want you to look up and put it in the group. Now, components of non-verbal communication. Appearance, appropriate dressing. We talked about that. Mannerisms, smiling. A smile talks a lot about what how you judge a person. And a body posture, how you're sitting. So, if you're sitting confidently, you're sitting straight up. So that will give a different type of conversation. People will make judgments before you even speak based on the way you look. Most definitely, your physical appearance matter. Where you dress, your hygiene, all matters. Obviously, it does. Okay, so we move that. Facial expressions, so obviously understand and express support and spoken words and the intent. Culture, now obviously from culture to culture, there are different, you have to understand there are different, so UK, there are different, some expressions are, you have to understand what the expressions mean and the cultural context to it. So uh, that's why I say try to see if there's any British serial running on BBC on the YouTube, try to see that because you understand what what their uh, context is, what their expressions they use, things like that. Anyway, but again, looking at the eye gaze, I've talked about cultural context and the UK setting, you should look straight to straight. So obviously, establish right away, 70% when listening. So when you're listening, 70% of the time your eyes should be on the other eye. 30% you might look here and look down on that. But 70% you're supposed to be listening, looking at the parent. 50% when speaking. So when it's 50% when speaking, you might be looking here and there as well. That is okay. Now when you're speaking to someone, obviously, if I'm speaking to you, I will wait till you look at my eyes and then I'll start speaking. So same here, when you're speaking to the patient or the family, you wait till his eye to eye contact is with you. Then you will start speaking. So that means you're ready to listen. Only when I'm looking at you eye to eye, that means I'm ready to listen to you. So don't start speaking when the parent is looking the other side and you start speaking. No. You just ask the parent, are you ready for me to speak to you now? Are you settled? Then she will look at you and then you start. Hand gestures are very important as well. So now these are all, I think you can understand as we explained just now what hand gesture is. So but that is a very brief understanding of what hand gesture is. And paralinguistics, basically, we talked about just now, is voice. So am I speaking confidently or am I speaking very slowly? Now, obviously, it's a bad situation, a difficult situation. I will speak very gently, very softly. And the pitch means very high pitch. Yes, I want you to go and that's very like an authority, very pitch and tone are almost similar, but basically you're talking to a family in a very high pitch. Uh, I'm sorry to say that I've looked at your child, baby, and your baby has got something we call Down syndrome. I'm sorry, there's nothing much we can do about it. So that is what is it? It's a high pitch. The tone is not very good. Did you like that? It's not very good, is it? Was the tone good? The same thing if I said a different tone. Hi, I'm Dr. Chakravarty. I've had a look at your, congratulations for your baby. He's doing well, he's active. By the way, there's something of concern to us, which I wanted to express. We have looked at his features, and some of his features seem to suggest that he has something called Down syndrome. So we are waiting. Have you heard of Down syndrome by any chance? So have you seen how my voice is? Yeah, Dr. Mandira, yeah. That was authoritarian, the first one. No, but now when I'm speaking, how does my voice sound? Right now when I spoke like that, how does that voice sound? When I'm speaking now? Anyone? Polite. He's polite and sensitive. I'm sensitive to the child, to the parents. I understand that they're in a difficult situation. They are in a pain situation. So I'll have to speak in a soft way. I will be in a nice way. So loudness also. So if I speak too loud, uh, yes, your child has been admitted to the ward. He's got, unfortunately, he has got overdose of gentamicin, and we are trying to see what we can do. How does that look? Does that look nice? So that way, loudness also has to be in a certain, not too loud, and again, not too less. If I speak very low, your child, by the way, your child was admitted to the ward, and we are, he was having some overdoses, and the nurses are looking and seeing what we can do. What does that say? Are you understanding what I'm trying to say? Is that confident or underconfident? The way I spoke to right now. Lack of confidence. What about the others? Why is no one else? Doctor, what do you call? Doctor, you got your, Mohammed, you got your exam, you're not typing anything. Please engage. Please engage with me. Please, if you're doing this, that means you're engaged. And you'll remember, if you don't do this, your brain circuit will not work. You'll forget. That's the reason I'm doing this. Please use that. So, lack of confidence. I'm not saying the words clearly, and I'm saying very, very underconfident. I'm very mumbled words. So that is underconfident. Okay, so that is what it is. I don't think about rhythm, we don't have to worry too much. Okay, but I hope you got to understand, practice it, saying in the right way. Body language, again, empathy. So usually you lean forward, you keep your hands close to each other, non-threatening. Non-threatening is you standing like that, you're standing straight and let the parents sit down. So that is very, and you do like that, that is threatening. Leaning forward, slouching arms, so like you bend forwards a bit and you stay very nicely in the same level and it talks very slowly. So that is empathetic language. That is empathetic language. So the task, obviously, when I said you're standing outside the room, go through the task. What is it saying? Go through it very carefully. What is the exact task? And everything, if you miss that point, everything will go wrong. Okay, everything will go wrong. So it might be, suppose you've got a leukemia patient. So there might be two type of tasks. I'll give you an example. One might be that child has been recently diagnosed with leukemia, and can you please break the diagnosis? Can you please inform the what the diagnosis is? So that is one task. The other task could be the same situation that if the child with leukemia, however, the latest investigations have shown that he is deteriorating very badly, and he might be having to shift to the intensive care unit. Can you explain to the parent what is the risk, or what are the risks which has happened, and why you are having to shift into the intensive care? So this is a separate task altogether. Are you there with me? The same patient with leukemia. Yeah. So if you don't know what is it you're wanted, and you just think of leukemia and just keep saying everything and everything, they will mark you off. What is it specifically they are wanting from you? All right? What is your specific job? Okay. So sometimes it might be just that okay, the child has been newly diagnosed with asthma, and you have to talk about the management plan. So that is the management plan. And sometimes it might be talk about the prognosis. These are all different. You should know what it is. So I told you this before. So when you're outside the room, get three information. Only three pieces of information. Get the name right of the parent and the child, who you're talking to, and then what is your task. These are only three things. And never refer to a baby as it. Obviously, tell the baby by name. Okay. So what is it that your content, mainly what you're going to say is information to be given, what parent or carer are expecting. So always think what is the parent, what the information are they wanting? And accordingly, in that limited piece of time, you talk. Now, monologue versus dialogue. Monologue, see what in the exam, they expect it to be a conversation, two-way speaking. But if it's only one-way speaking, that is a monologue, and you will fail. If the other person is not speaking, explore the reason or give time. Silence is not awkward, so sometimes we have to allow for some silence. When it's a bad news, or you're waiting for the child to come in the front. There are some times when the parent is very upset. You have to give a few seconds for them to silently absorb the bad news. Listening is sometimes all that is needed. And sometimes with a bad prognosis, you have told them, and the parents are saying, okay, they are reminiscing about the good times, okay, the child has, how good he was at studies. Or suppose today he's got a very bad prognosis, he's had a bike accident. But sometimes, the parent will talk about good times he's had and things, and you have to just listen. How he's been a good boy, how his grades were getting better. So you have to listen then. That is enough for you. So general rules obviously congratulate as you know, sorry, acceptance of liability. So if there is any problem which was caused from the hospital point of view, now I know you suppose that drug overdose, you didn't do the drug overdose, but because you're speaking on view of the on in regard in representing the hospital, so you will have to be apologetic. Okay, you will have to be apologetic. You can't say, oh, I didn't do the mistake, someone else did, so I will give you the sister's name, you go and fight with her. No. If the patient asks, can you give me the number? Who is that sister who did this mistake? You can never tell that. You should never say that I'm sorry, we have looked into it, and she appropriate steps are going to be taken against her. So that way it's good. That is straightforward. Now, next was avoid jargon, empathy, body language, open posture, switch off phones. Obviously, you know that empathy, for avoid the jargon, and switch off phones and pack. Obviously, you switch off when the parents are having a chat with you, and ask them sometimes. Okay, it's a difficult information. Suppose the child has been diagnosed down or whatever. So you say to the parents that, is there anyone else you want to bring with you? And you say to them, okay. And do you want someone to? I know you're alone. Do you want to? And suppose you're going to bring bad news. Do you want anyone to be with you? You know, sister, the senior nurse. Do you want them to be with you? So at least you have to ask those questions. And ideally, there should not be any table or obstruction in between. There should be a free space between them, between the main the person who's the parent and the your side. So there should not be a uh, same level, and ideally there should not be any table. There should be a free space between you two. Okay, so these are the basic rules. Now this is not a history station where a lot of people get confused. Those stations are different, and they try different skills. So don't try to elicit further history, but if the role player offers more history background, that is yeah. So that is very common for people. So here is communication. What is, can someone just say, just to wake, what is the difference between communication and history taking? Please type very shortly, briefly. What is your understanding? What is the difference between history station and communication station? Please write down. Please type. Please type. So Rohit Kumar says information gathering versus providing. So Ashanko says two-way. Navandira says history is gathering information and communication is sharing information. Yeah. Aniruddha says in communication there will be reciprocation of data and emotions. So I think you've all got it more or less, the main points, right? So obviously the basis is history is more about getting information, gathering information, and communication is sharing information. But again, as Aniruddha says, it is communication is not just giving data. It is related to reciprocation of data and emotions. So that is the whole point of it. That's good. So don't try to elicit further history. But if the role player is saying more information, that is up to you. However, that it is important that you check prior knowledge and understanding. Okay. So you should to know how much they understand and check knowledge of them before you talk to them. So anyway, so the confusion, no history station. So what do you do? Preparation. So you start with any scenario, body language, you speak in a nice way, you smile at them. If it's a bad situation, don't smile. Just say hello. Obviously, if it's a bad prognosis or bad, will you come with a big smile? You give a very small smile. These things matter. Okay. Warning shot. So give some idea what is a good situation or bad situation. So give some idea. Say that yes, we met before. I'm the doctor looking after your child, and unfortunately, the child has had your teenager was having a bike ride, and there's been a bike accident. He's having head injuries right now, so he's taking rest. They have put it on a ventilator, and we are hoping that he gets better at the earliest time possible. So that sort of thing. But anyway, like preparation, like body language, warning shot, break it down some hope possible. So what is it warning language? So suppose let's take the case of a Down syndrome. So what we are saying, the preparation is, oh, hello, congratulations, your baby is born. And then, by the way, have you noticed anything about your baby? So just to warning them something's not right. Have you noticed, you were there earlier. Have you noticed anything about your, little baby? No, doctor, not sure that. Well, we just noticed that there were some signs and which suggests that you maybe having a condition called something you see, Downs or whatever. So that's what it says. So warning shot is before that only you say something maybe did not look right. Don't use the word down straight away. Okay. So give some warning, then you give the whole, the details from the farm and all that. That's fine. So it says communication, one should convey information, it should take and gathering information. Okay, that's all right. So breaking bad news. Warning the patient that bad is coming when losing the station. So bad news is a different table altogether, and this is a very challenging one. So you have to be very good at it. But I'm telling you, if you do it properly, you will get really good marks here. So I would say I expect of you, all of you, to get 12 out of 12 in these scenario sessions, because we excel in this. We are proud about the way we teach you this, and you'll get plenty of practice. So breaking bad news, warning the patient, the bad news coming. Sometimes they know it's better. You send them a telegram or a letter or something. Unfortunately, I've got some bad news to tell you. So that is, or I'm sorry to say that we have got some information about baby's condition, uh, uh, which we are concerned about, something like that. And start the level of comprehension and vocabulary of the patient. Use non-technical words and you avoid excessive bluntness. Avoid bluntness. Obviously, don't say too bluntly, oh, your child is in danger. The child is born with Down syndrome. Oh, child learning will be bad and smoking is horrible. I mean, sorry, it's condition not very good. You would not say very bluntly. You would have to say that, yes, your baby is in the hospital right now. We overdose of medicine, but it seems it's a very high overdose. But anyway, we have brought the child to the next hospital nearby, which is a tertiary level unit, and they might be doing something called renal dialysis, and which is basically a special treatment with the blood through the kidneys, and yeah, hopefully we might get better. But we are waiting for the best. We are waiting for the best. At the moment, we're keeping us fingers crossed. So keeping fingers crossed means we are not sure what is going to happen. That term is used in the US, in the UK very much, or in the US as well. So okay, Padma, communication is we should convey information history to and history tracking and gathering information. And communication, there will be a reciprocation of data. Yeah, so people will, both of you should show some emotions. You know? Don't think that I am doctor, so I don't have any emotion. No. So breaking that as small chunks. So don't give too much of emotion. So small chunks and checks periodically as the parents understand it. So give a little bit of information and see, do you understand what I'm saying to you? Are you comfortable with what I'm saying to you? That sort of thing. When the prognosis is poor, and avoid using phrases such as there is nothing more we can do. So never say this. Breaking bad news. Never say breaking. Oh, there's nothing more to do. You already said what we should say, isn't it? What should we say? We are trying our best. We're hoping for our best. You know, we're trying everything we can. So that is how I would do that. And good pain and control. I think we know that anyway. Untoward incident, emphasize that it will be investigated properly. So it's a bad incident. Don't promise that involved person will panic. The parents might say, oh, I want to know who's the nurse who gave the wrong dose of medicine. You can never identify. Say that when she has been identified, she gave herself up and she is being interviewed by the committee. So that's sort of thing. Okay. And idea is to build a fail-proof system rather than a name and shape. Okay. Now, if the parents want to make an official complaint about something for whatever reason, then you have to say to the parents that, okay, we have got a complaint system here. Please wait a minute. I'll get the sister to bring the official complaint book. So that is the way you should know it works here. All right. So conflict resolution, so blaming, threatening, so it can be because of your sisters are unhappy with this young guy because registrar who has recently joined feels very threatening and very aggressive. So then you have to do it in a nice way. You have to talk to the your registrar and also your junior registrar, and you have to resolve the conflict. So blaming, threatening, unacceptable. Try to gain confidence and explore the probable reasons leading to odd behavior. Why they are odd behavior, offer people support, but not something that you cannot deliver in a position. So obviously, never give false promises. That's not what they're trying to say. But say what is being positive. That is going to the nearest unit, which is a tertiary level unit, and there are a lot of doctors with specialized skills who will be looking after you maybe as well. That is how you do the conflict resolution. One second. Information possible. So where you don't know anything much, just give what a little you know. Ask them what they know and ask them to draw. That way, it's a clever way of going about that. And again, explaining a diagnosis you have no idea about. So any diagnosis suppose has come, suppose a child has Williams syndrome or whatever. Ask if there is anybody in the family with the condition and is it familial. So it's basically this condition may be running in families, okay, male members. But sometimes there are genetic conditions there. Or after you found out, sometimes you ask, is there any particular question from you about the care and all, just feel free to answer. And if you're not sure about anything, say that I'm not sure. Okay, these are all acceptable. Reassurance. So important to reassure, but patient must be appropriate. So when something has gone wrong or whatever, so you have to reassure them that it will get better. And don't say don't worry when there is a lot to worry about. So any scenario where the child, it's what do you call? Don't always gives what do you call you? You're reassuring the parents, but don't say don't worry, because that's a very typical thing. Or everything will get all right, because sometimes it may not all right. The child who's admitted to, in the what do you call it, the intensive care may not make it. As simple as that. He might have infection 6 months down. Say that we are hoping for the best. We're taking all steps, and let's wait and see. That sort of thing. And think about how to answer the question: is she going to die or is he going to die? Well, we are not sure. We are trying our best, but hopefully she's got a better chance. Okay, once you've been admitted to the hospital. So that is how you would offer. Our offer support as appropriate and volunteer to find out if you don't know anyway. Okay, so that's all right. Reassurance is important. Facts must not lie. If you don't know the answer to a question, you say that I don't know, and because you can't know everything, and all facts information will be corrected. Yeah, so any information you say, it has to be accurate, otherwise it doesn't hold. So non-confrontation. Where is non-confrontation? You're a law supporter, enforcer. Don't blame, accuse the parents or the carers. So this is the main approach actually. Don't interrupt the parent rules, career, or don't interrupt the parents or career role play. Yeah. So how much the info, whatever is your duty as a parent, how much is the duty of the carer, to maybe take out once in the evening, how much you have time with the baby. So this should be very fixed. So the routine is there. And don't lose pancreatitis, be rude, don't be dismissive, even if you don't agree with their point of view. So sometimes if they are different opinion, then you say that no, actually I believe in this, but anyway, probably not agreeing. We'll talk about something else. So that is how it has to be non-confrontational. So this is the last slide. Keep calm and good luck. That is what people are giving the exam. So I hope you. I know what's the time now. So 10:15. I think we have 15 minutes past. So I hope you've got an idea about what it is. So this is non-confrontation, one of the difficult ones. I will talk about this bit more. So basically, this is a situation where it is more of NAI sort of situation. Now, in a non-accidental injury situation, what you have to know, you are not a law enforcer. So don't take the role of I am the policeman and I'm going to say, yes, mother, I suspect you, maybe you have not been looking after the baby. Baby has a dent or there is some bruises on the body. So what happened? Please tell me what happened. Why do you think this happened? No, you cannot. You're not here as a policeman to ask questions like that. Okay, that's why they gave this language. You have to say that we are looking for a child, we are worried about this multiple bruises on your baby, and we want to carefully do some investigations, and our senior consultant will come as well. We try to find out from our point of view, why, uh, whatever the problem, what is wrong, why these bruises happen. So you're not blaming. You mean the NAI, so you are not the one to blame, whether the mother is to blame or who's to blame, you don't know. Okay? Try to convince that you're working hard for the best interest of it. It is safe for the child to stay in hospital. So that's why we want that you stay here, don't go home. If she's had some bruises or some cutting, we want that is you offer the support. You're not a law enforcer, obviously you're not the police. And blame the parent. Oh, you don't look after your baby well. That's why your baby, has come to this situation. You should never blame them. That is not acceptable at all. And don't interrupt a parent or a pair career, the role player's role. When the role player is saying something, never interrupt. That means they are giving this information to help you. Okay, don't lose patience. That's okay. I think we've done that. So that's my part of the things. I hope you liked it. I hope it was useful. Any questions? Any questions? I will have a drink of water. Any questions? You can now use you can talk, you can use the microphone. Any questions? We will start doing communication scenarios, from later on. I think today it's too late. We can't do a communication scenario. But I hope, are you okay with the basic understanding of what is expected in the exam from a communication scenario and
Yes.
what it means? Yeah, what is the body language, at least basics of body language, and what is how you're being marked? yeah, how you're being marked in the communication scenario, and what is the difference from history taking. Yeah, we also came to know about what are the different types of communication scenario. Yeah, so I hope these are all okay for you. You have to obviously will practice that. And if there's any question, please feel free to ask. You can unmute and ask.
How
Carry on.
to ask nicely to a parent to check the understanding of the existing knowledge.
Yeah, so
While
that's a good one.
I'm giving some kind of information
Yeah,
sentence by sentence.
yeah,
So and the role player is keeping mum. Then
yeah,
what is the best way to ask to check
absolutely.
the
Okay. So, see, the parent is keeping, why do you, okay, if the first of all, if a parent is keeping mom, and you, as you said, very, you are saying, and I think there is a rule, no? I forget the exact number of seconds, but if you're speaking for more than, I think it was 15 seconds or 20 seconds, please check it out. And there is no answer from the other side, that means, in fact, you will be
something
marked
is
off.
wrong?
Yeah, something is
Mm.
wrong, or it is not expected. There is actually a, please look it up on the internet. There is a sort of number of basic time limit that usually after 15 seconds or 20 seconds, the other person should respond. And if there is not responding, then there is a disconnect. Maybe that person is not interested or thinking about something else, or so that is the basic rule. So first thing that if someone is not responding or absolutely mum, she might be very upset. So she's not saying anything, or very shocked, or what else could it be? Could be
So she
upset,
is
very
not
shocked.
understanding. She is
Yeah,
not
understand. Yeah,
understanding
absolutely not
anything.
understanding. So what is the
Mm.
language? Aniruddha has asked, what is the language you will use? That's a very good thing. What is the exact language you will use? So anyone want to say, or you can say, or you can put it in the chat box. What is the language you use without, without making her feel bad? You understand, you want to make sure that she's understanding. How would you put it to the parent?
So if it is a genetic condition, then we can ask like, have you heard of this condition, and is there anybody in your
No, I think
family or like that?
no. What I think I'm just trying to say is it may be any condition. It doesn't depend on one particular,
Hmm.
any condition. You're saying something for a few minutes and they're quiet. So you now want to check whether they are understanding from what you're saying. Okay. So what is the nice word? What is the nice word, exact words you will say to make sure that she's understanding without appearing to say as if that she's a moron, she's dumb.
Okay, am I clear to you? Am
Okay. So
that
here
I
I think
can
let
say,
us see, let
or
us see.
are you
You're
with
saying,
me?
are you with me, Rohit Kapoor? That's absolutely good. That's a good
Hmm.
one. So see, these are the
Okay.
notes you should take. These words have to come automatically to you. These are the
Hmm.
exact words. That's why you're doing this course. Now, hope you understand what I am saying. How does that sound to you? If you're the
No,
parent and I
sir,
say,
you cannot say
oh,
anything to him or her. You have to
I
be
hope
like,
you
am I
understood
clear
what I'm
like that?
saying. Does it sound
Before
very
that.
nice? Does it sound very good?
Hmm.
Anuruddha, how does it sound? Hope you understood what
Mm,
I'm saying.
No,
I
no,
would
no, no.
perhaps go with am I making myself clear?
Absolutely.
Hmm.
Hope you understood what I'm saying means I am saying rightly. Your fault you
Mm.
cannot understand because you're dumb. That's what it means
Hmm.
actually.
Hmm.
But here you're taking the blame on yourself. That I
Hmm.
hope I'm making myself clear. Or do you want me to repeat that again? Have I made myself clear? So that
Hmm.
is, that's a very nice phrase. It sounds good. That, maybe I
Hmm.
need to put it again for you. It sounds so lovely. And this is, believe me, this is how you're marked in the exam. This is how the examiner is looking for this word. It's like music to his ears. When he sees you saying these words, he will know who's the person who's trained properly and who's the person who's just
Hmm.
making it up. So that's a good one. Any other queries? Anything else?
Sir, I have a question.
Please.
Um, Sir, about the timestamp, like first 4 minutes is for like we are
Yeah,
writing
outside
notes
the room, waiting.
and we are taking notes of the names and
Yeah,
task and
yeah, yeah.
everything.
Three. What are the 3 points?
Then we,
There are three
right,
points.
one is name and the child's name and age and like gender and the parents' name, like the carer names and
Yeah,
our task.
yeah. Very good. Never forget that. Okay. Then carry on.
So, sir, then we go inside and then there is 6 minutes.
Yeah.
So in
Six
six,
minutes.
after 6 minutes, they will give a like bell, like
No, no, six
or
minutes is
knock.
6 minutes. That's it. Done. So what they will do, now I think it is, was it 9 minutes? Just have a look again. You
I
will
think
get
it's
a,
9 minutes.
yeah, you will get a warning at 3 minutes. When 3 minutes is left, you will get a warning. Yeah, Shanko
Okay,
has said
okay.
6 plus 3, right?
Sir,
You're right.
so, right.
Six
So,
plus three,
sir,
4 minutes, 4 minutes outside the room. Forget that.
right.
You enter the room, you will talk for 6 minutes, then get a warning, knock, knock, then three
Hmm.
minutes. So that's when you summarize.
And the role like the role player leaves then. I mean, after 6 minutes.
No, 6 minutes, nine. As soon as 9 minutes is done, that's it. It's finished. So no one is going to ask you any question there. Communication scenario, so you have done it and
No,
he's
sir,
marking you quietly.
one thing that just I'm trying to understand that whether we have to do we have to summarize something to the role player also and then to the examiner?
Yeah, why not? Because at the end, so what did you,
Hmm.
so what are we talking about? For any useful interview or any useful communication, it is
Hmm.
important that at the end you have to summarize to the role player, to the parent, that
Right.
okay,
Hmm.
Mrs. Mandira, is it okay if I just summarize what was the main thing we talked with you just now?
Hmm. Hmm.
Okay,
Hmm.
so as I said to you, you have a wonderful baby. Baby's crying, baby's active, he's lovely, he's feeding very well. But there is something at the same time, we have talked to the other doctor as well, and we have a bit of concern about the baby's appearance and his looks, and we are
Right.
suspecting that the baby might have something, the condition called Down syndrome. At the moment, it's not any definite risk. It's not something endangering his life, so there's no risk to his life as such. But anyway, what we are going to do, we might do a few more tests, but we'll talk about that in more detail. My consultant will get in touch with you in the following the next few hours, and we'll take it from there. And I'm giving you a leaflet in the meantime, which you can, the system will give you a leaflet where it talks about Down syndrome, so you'll have a bit more information. Is that all right?
Right.
So that's the summary.
Right. So,
So you know what
sir, here we are summarizing for the role player, and in in
why you're
other
saying
sessions
summarizing
where
for the role player? Oh, why you're getting so confused? Role player is what? You are, yeah, for your task is to talk with the communication. What is the task?
Hmm.
The role player is there. Your first was your task. What was it? So suppose the task was to break the bad news, or suppose
Right.
give the suppose I'm giving you another example. So gentamicin overdose. All right, overdose. So initially, obviously, there will be a bit of drama. So you do given the introduction. Hi. Suppose it is Doctor. Hi, Mrs. Uh, I don't know, Mrs. Shivani or something. You've gone to the initial part. Okay, I'm Dr. Chakravarty, and how do you know your child is? Are you up to date? And then they say, oh, I heard something about something went wrong about the dose, and then she gets very angry. So that part is done now. Okay, I'm sorry to say this happened, and okay, we are making sure she's getting better. We're giving all the medications, and the sister, we have also making sure this does not happen again. So you've gone through that part. Okay, and we have a system in place, and obviously I know you might want to make a complaint. So the system will come to you with a complaint letter and explain to you the details of how you can make a formal complaint. So that you have finished that. Now you're summarizing. Okay. So now, so if it's all right, Mrs. Roy, can I make a quick summarize just to make sure that we are clear with each other about what has happened between what we have spoken about. Is it okay if I make a small summary? Yes, okay.
Right.
So, as I explained to you, unfortunately, one of the medications given to your little baby was gentamicin was given 10 times the normal dose. Your baby has, so anyway, we are taking steps for it. We are giving adequate fluids and adequate medication. We have taken adequate steps to ensure that no further to minimize the damage to your child's kidney. We are going to repeat some investigations, and we are keeping a close watch at the moment. At the same time, I know we are very upset. We have taken some steps to ensure that the person concerned does not make this mistake again. And thirdly and finally, I know in this situation you're very upset. There is a formal complaint system in place. The system will come to you very soon so that you can, and she will guide you with how to make the complaint system. Finally, my concern will come to speak later on. Is that okay? Is there anything else you want to ask? So you put the main point wise. Okay. Initially, it was more like a free flowing thing, a natural flowing, because you would have to respond to what the parent is speaking, isn't it? you would be responding to the parents' emotions, and then so it would go a bit, bit structured, but bit according to which way the parent is taking it. But when you're summarizing, this is the problem, this is what we are doing, is not at immediate risk. And the other issue was this mistake does not happen, because the parent told that I don't want this to happen again. So we have got a system in place, so this does not happen again. We'll be having a meeting soon. I know there's a complaint system in here. I know you want to make a complaint. Someone will come to you so that you can make a formal. So the main points, very 3-4 lines, very briefly. So that is how actually it should be with any interaction with parents. That's how it should be. Any communication scenario. So
Right.
if you look at it, when you did a history, when you did a history as well, yeah, remember when you did a history, there also it was at the end of it, I think you made a brief summary, but that obviously that summary you would ideally do in front of the parent, a very brief one. So you're making sure that you're not missed out anything for your benefit if you have the time. And just tell me, you would ask the parent, is there anything more important you'd like to tell? Because that is a good way to know is there anything in the history you're missing. And then you would make the summary. That difference would be that to the examiner, you would make a 3-sentence summary.
Yes, sir. Exactly.
Remember,
That is what
3-sentence
I'm
summary.
asking. Yes.
So what was the difference? Tell me 3-sentence summary in a history taking. What is a 3-sentence summary?
Sir,
Suppose
yes,
any child, let's say any child with cystic fibrosis who was deteriorated and has been admitted for antibiotic. So what would be the 3-sentence instruction?
so the first sentence will be the initial diagnosis, like the past, like whatever happened in past. Then the second sentence will be whatever is happening right now. And third sentence will be how will you manage it like in future.
Absolutely. So in that case, you would say, right, we have got a 14-year-old Rob who has a history of cystic fibrosis, who has cystic fibrosis recurrent infections, where we've been admitted several times in the hospital. Now he has presented with a 7-day history of worsening fever, worsening cough, not generally getting very unwell. Also passing he lost a lot of weight. So these are the main concerns the parents are concerned about. I suspect he has got obviously superimposed chest infection, and on top of that, he might be having developing diabetes. So the plan of action would be to admit him today, send some investigations, cultures, sputum culture, some investigations, and look at his contact with his hospital, and start him on the appropriate antibiotics. So very briefly, background, relevant background, main points in the present condition, what you are suspecting, and what you want to do. So mainly three parts to it. Okay, but again, see, I'm also not doing it perfectly as well. I would like to do it, but you practice and practice, and it becomes more smooth. Yeah,
Right.
but it's very important to get these different. I hope with all of you, you can understand what is the different structure for history taking, communication.
Yes.
The
Sir,
main
what
points.
I tried to understand is that here we are summarizing for the role player. Like here, examiner has no say.
Examiner is
And
just
in
marking you.
history,
He is like a
yeah,
voice.
he's just there.
He's
Yeah.
there. He's just
So
marking
we
your
don't
marks
have
to see
to
that you are
talk
doing.
to
No, you have
him.
nothing to do with it.
And
You have
in
nothing to do with
history
it.
question, we are summarizing it in front of examiner. Like he
Yeah,
has,
because
like,
the
we have to
examiner will ask you,
management
because
plan
the
and all.
examiner will ask
Yeah,
you, the
that is
examiner
a
will ask you,
difference.
yeah, so examiner is going to ask you, so what is your, do you like to make a summary of what your findings? That is how it will start. So here in
Right.
communication, no one is going to say anything to you. Okay, so what is your summary of the case? And then you say, background, this is this. Okay, anything else? Dr. Mohammed, you are very quiet, but you are the person who got your exams in May. Are you here with us, or are you tired, or are you here with us? I don't know if Dr. Mohammed is still here. Anyway, and if anyone else has got anything to say, otherwise we'll call it a day. I hope it was useful. And
Yes,
before I think what I'd like you to do as usual in the WhatsApp group, please put three things you have mainly understood about communication, which you think was new, or which you felt you didn't know before. Is that okay? 3 things which you felt was new to your understanding, which clicked.
Okay.
Put it in the WhatsApp group, and I will check it again. Okay. Hope it was useful. Thank you. Good night, everyone. Okay?
Thank you, sir.
Good night.
Good night.
Good night,
Good night. Bye bye. Bye.
sir.
Okay.